about the number of the sessions required for the treatment. That depends on the complexity of the issue and how deep do you want to work. Let's take sleep, for example. How big is the problem? Are you having trouble falling asleep, staying asleep, sleeping deep enough? Are you experiencing nightmares? Do you wake up lacking energies as though you didn't get any sleep? What is the actual problem? If you have problem with falling asleep, for example, due to what? Are you in pain? Do you experience anxiety? Do you worry about your future? What keeps you awake? Yes, we can work on the very surface and give you hypnotic suggestions, program you for falling asleep. But if the problem is much bigger than just being able to fall asleep, anxiety, fears, whatever, resentments about past, then we have to work on that. And that needs more time. What if it's a chronic issue that you've been struggling with for years and you don't even remember how it started? Maybe there is some illness, maybe a lot of pain. Maybe you are on medication that disrupts your sleep patterns. Now we need to address all of it, and that takes time. So you are calling to a hypnotherapist thinking you just need one session to fix your sleep. And hypnotherapist, understanding from the experience that it may entail much more, starts asking you all sorts of questions. How is your lifestyle in general? How is your health in general? What do you exactly mean by not being able to fall asleep? What do you exactly mean when you say you cannot sleep? And while you are listing all these problems, hypnotherapist has to figure out how much time will I need to properly address all of these issues. You have to address the root cause, because working on the symptom, not being able to sleep as a symptom, is not effective. You need to address the root cause. So sleep can be from one session to maybe 4, 6. Weight, again, what are the components of the weight problem? Do you need to just stop craving sugar? 1 session. If this is an emotional eating, you need more, maybe 2, 3 sessions just for that, to figure out what are you trying to fill in. If this is stress, again, depends on how deep is the problem. Weight is actually one of the most complex issues. If this is a serious problem, to work with it seriously, we need whole program. 6, 8 sessions, 12 would be perfect. For smoking, I would say 1 to 4 sessions. To minimize the amount of sessions needed, you need to do good prep work and supplemental hypnosis recordings. When I take in a client, they get a preparation package. There are some prompts for self-reflection, the form with the questionnaires. This is not just for me to understand their situations, their pain points, but also it's for the client to clarify the actual issue and the goal. Then I have a little coaching video session explaining how hypnosis works, how they need to prepare, and I have few recordings, hypnosis recordings, for relaxation, for sleep, for boosting mood. The purpose of those recordings, of course, to help client to feel better as soon as possible, but also to teach the client to be hypnotized. If you've never been hypnotized or have never meditated, it will take extra time for me to teach you. And I don't want to take that time out of your appointment for which you will be paying for. I'd rather you do it on your own at home with recorded sessions that I provided. So you enjoy those recordings on your own time, at your own pace, and you are training your mind just like a muscle to be hypnotized. By the time you get to the actual appointment with me, I know that your mind is ready for deeper work. Now I will be able to hypnotize you deeper, therefore everything we'll do in the session will be more effective. And it's great that our technologies allow us to do all this prep work ahead of time. And I also provide post-appointment package with more hypnosis recordings. This way you don't have to come back for another appointment for simple reinforcement. You can do it with supplemental audio recordings. So when I work with clients, every session is a deep work. We don't have to take time out of your appointment for simple relaxation, for teaching you how to be hypnotized, for teaching you all the techniques, stress management and relaxation techniques I would like you to use at home. I don't have to do it during appointment. I can provide it in recorded format. So during appointment we only do deep strategic work. And this is how I teach my students, even while they're still learning. They're already building a library of supplemental audios and videos. But not all hypnotherapists work this way. That's why you need to talk to them, ask your questions, and understand their process.